Memorial Hospital, so I can speak from that perspective as well. இப்பொழுது எங்களோடு இணைந்திருக்கும் எல்லோருக்கும் வணக்கம். நானும் தாழ்னியும் இன்று COVID-19 பற்றி கதைக்க உள்ளோம். இதை நீங்கள் ஜூம் மீட்டிங் மூலமும் இன்ஸ்டாகிராம் லைவ் மூலமும் காணலாம். நாங்கள் ஒரு சின்ன ப்ரெசன்டேஷன் தருவோம். அதுக்கு பிறகு உங்களுக்கு என்ன கேள்விகள் இருந்தால் நீங்கள் அது இன்ஸ்டாகிராம் லைவ் ஃபீட் மூலம் கேட்கலாம் அல்லது ஜூம் மீட்டிங்ல ஜாயின் பண்ணி அதுலயும் கேட்கலாம். So the COVID-19 disease has the following symptoms. Most commonly, the symptoms are fever, cough, difficulty breathing, fatigue, headache, sore throat, just like any other cold, really. Although we are learning more and more about atypical presentations of the COVID-19 disease, some people are actually presenting with nausea, vomiting, abdominal pain, or diarrhea. A lot of patients, about 70% of the patients actually are mentioning that they have lost their sense of smell, which is not uncommon in upper respiratory tract infections, but it seems to be very typical for the COVID-19 disease. So this is something to really look for. Other populations that present with atypical symptoms are infants. So children, sometimes their only sign is just poor feeding or lethargy. And seniors, sometimes, you know, they get confused or they tend to fall more when there is something going on with them. And we've seen some elderly that only have those symptoms and they turn out to have brewing infection of the coronavirus. So கூடுதலாக COVID-19 வருத்தம் வந்து காய்ச்சல், இருமல் அல்லது மூச்செடுக்க கஷ்டமாக இருக்கும், அல்லது உங்களுக்கு தலையடியாக இருக்கும், தொண்டை நோகா இருக்கும், அல்ல தடிமனா இருக்கும். பட் இப்போ நாங்கள் இந்த 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 அறிகுறிகள் இல்லாமல் வேறு அறிகுறிகளோடைய மக்கள் வருகிறார்கள். அது வந்து நாசியா அல்லது சத்தி அல்லது டயரியா அல்லது வயிற்றினோடையும் சிலாக்கள் வரையினம். அண்ட் கூடுதலான நாட்களுக்கு அந்த மனம் வந்து அவையால் மணக்க இல்லாமல் இருக்கு. இப்போ அதுவும் ஒரு COVID-19 வருத்தத்துக்கு அதுவும் ஒரு அறிகுறியா இருக்கலாம். மற்ற சிறுவர்களை பார்க்கல அவர்கள் கூடுதலாக சாப்பிட்றது குறைவாயிருப்பினம் அல்லது பால் குடிக்க மாட்டினம், சரியான சோம்பலா இருப்பினம், அதனால் அதுவும் ஒரு அறிகுறியா இருக்கலாம். வயது முதியோர்கள் பார்க்க போய்க்கல அவைக்கு மேபி வாக்குமாறல் அப்படி வரலாம், அல்லது திடீரென்று அவை விழுகிற மாதிரி அந்த அறிகுறிகளும் இருக்கலாம் இந்த COVID-19 வருத்தத்தால.
So what should I do if I have symptoms of COVID-19? So if you're experiencing any form of the symptoms that we just described, as Subani just described, especially even with the mild symptoms like the runny nose, cough, headaches, anything of those sorts, it is recommended that you do separate yourself from other people. So if you are going to work and you notice that you are experiencing any form of these mild symptoms, it's important that you do call your employer, let them know, and you do get yourself home. If you are home, it's important that you are self-isolating yourself from other people within the home as well. So if you are outside and you notice that you're starting to experiencing symptoms, it's important that you do immediately go home. If you are trying to avoid taking TTC or any kind of public transit, we do recommend taking a cab or any kind of shared vehicles like that. If you are taking those kinds of vehicles, we recommend to sit in the back seat opposite to the driver with the windows down, if you do have access to a mask, wearing that mask as well. When you are staying at home, when you are experiencing some of these symptoms, you can call your local public health unit or your family health care provider as well, just to talk through some of the symptoms that you're experiencing. If you have questions about testings and assessment centers, you can inquire with the local public health unit or your health care provider as well. And they will also provide you all the recommendations for self-isolation, how to self-isolate, especially if you're in a household with other folks in the house. So if you have children or if you have elderly in the house, they will go through all the examples of how to isolate yourself within the home. If you do need to get yourself to a medical clinic or an emergency department, it is recommended that you do let the clinics or the emergency department know ahead of time prior to your visit, so that they're aware of, and they're aware that you are presenting COVID-19 symptoms, and they can take the necessary precautions on their end to help reduce the spread of the virus. So here's another, this is actually what the ministry had put this up in terms of how to control the spread of the virus, mainly staying home as much as you can. If you are an essential worker, just making sure you are taking that extra precautions in terms of covering your sneezes, coughs, wearing a mask, washing your hands more often, keeping sanitizers in common spaces within this, within the essential workplaces. If you are presenting yourself with any forms of symptoms, it is advised that you do go home, and even when you are an essential worker. So in terms of avoiding contact with others, we are recommending the physical distancing as recommended by many people, and you've been hearing it on the news as well. The 2 meters apart from individuals, especially in public spaces. So if you're going to the grocery store, just making sure that you are maintaining your distance. For seniors, if you do have access to mask, wearing a mask, even when you are going out, for example, even if it's general just walks that you're taking, or if you are going to do essential work such as grocery shopping, trying to limit your distance with other individuals, and also wearing a mask if you do have access to it. So who should wear a mask, or when should I wear a mask? This is a question that's been coming up a lot, and it's changed gradually over the last couple of months in terms of who should be wearing a mask or when someone should. Our recommendation at this point is if anyone's showing any symptoms, even if you are self-isolating within the home, if you're living on your own, you probably don't require a mask within the home, but if you do live with other people in the home, and if you are experiencing any form of upper respiratory infection or symptoms, it's important that you do wear a mask just to cover any kind of respiratory droplets that you might be putting around on other surfaces around the house. If you are going out, you could also be wearing a mask as well, just to make sure that you are keeping your own respiratory droplets from going on to other individuals, and also making sure that we're practicing the physical distancing. So how long after catching the virus will someone get sick? So usually the incubation period is about 14 days, which means that from the time you've gotten into contact with someone that might be having respiratory symptoms, or is a COVID positive individual, it usually takes about 14 days to show the symptoms. Everyone's body is different, and you'll notice that everyone's symptoms are very different as well. But generally, we are starting to see that people usually start to get the symptoms within the 4 to 5 day range, and they start to get a little bit more sick, and their symptoms start to progress more. By the 10th to the 11th day, they do start to get a little bit better. And generally, most people are experiencing more of the mild symptoms, and that also depends on other underlying factors such as age, underlying health conditions as well. People with the more severe symptoms, so this is, for example, shortness of breath, difficulty breathing, anyone with chest pain, all of those are typically seen as more severe symptoms, and those are individuals who are usually admitted into hospital because they're having inability to breathe on their own, and that's usually within the 2 to 4 day period in terms of the incubation period.
So if we look at the coronavirus path, I guess, so like the cases, if we compare Canada to other countries, we can see that Canada is actually doing quite well. So this is a logarithmic scale, and the 10,000 line is here and 100,000 line is there, so it's fairly close. So you can see that Canada is actually sort of in the middle. We're doing worse than some countries like South Korea and Japan, and but we're doing way, way better than other countries like USA and UK. So I would say, you know, we're doing a good job so far. And so we're sort of in the middle. We're not the worst country, but we're not the mildest country either. So, and if you look at the cases within Canada itself, if you look at, if you compare it to other provinces in Canada, Ontario and Quebec seem to be the provinces with the highest numbers. So the Quebec numbers are the dark purple, and the Ontario numbers are the light sort of purple. You can see, you know, most of the cases are really either in Quebec or Ontario when you look at it. And that's also because, you know, Ontario and Quebec also have more population, obviously, and they also are more densely populated than other provinces. And I think that is really the reason why we see why the spread is happening much, much faster in these two provinces. So in the மற்ற உலக நாடுகளோடு நாங்கள் கனடாவை வைத்து பார்த்தால் இந்த நாட்டில் எவ்வளவு கொரோனா வைரஸ் இந்த வருத்தம் பரவுது என்று பார்த்தால் கனடா ஒரு இடைவெளியில் இருக்குது. ஸோ சில நாடுகள் லைக் சவுத் கொரியா அண்ட் ஜப்பான், அங்கே வந்து அந்த கேசஸ் அந்த நம்பர் வந்து குறைவாக இருக்கு கனடாவில் விட. அண்ட் சில நாடுகள் யூஎஸ்ஏ, யூகே அப்படியான நாடுகளில் கணக்கு அங்கே நிறைய கூடவாக இருக்கு கனடாவில் விட. ஸோ கனடா இஸ் டூயிங் ஓகே இன் டர்ம்ஸ் ஆஃப் ப்ரிவென்டிங் த ஸ்ப்ரெட். அதே மாதிரி மற்ற ஆன்டேரியோவையும் மற்ற மாகாணங்கள், கனடியன் மாகாணங்களையும் நீங்கள் ஒப்பிட்டு பார்க்கலையும் கனடா ஆன்டேரியோவிலையும் கியூபெக்லேயும் தான் கூட ஆட்களுக்கு இந்த வருத்தம் பரவி இருக்கு, தொத்தி இருக்கு, ரைட்? இந்த டார்க் பர்பிள் வந்து கியூபெக்ல உள்ள ஆக்கள், அண்ட் இந்த லைட் பர்பிள் வந்து ஆன்டேரியோவில் உள்ள ஆக்கள். இதுக்கு காரணம் வந்து ஆன்டேரியோலையும் கியூபெக்லையும் தான் கூடின ஆக்கள் இருக்கணும். கூட ஆக்கள் கிட்ட நெருக்கடியாக இருக்கிறபடியா இங்க கூட பரவுதுன்னு நான் நினைக்கிறேன்.
So this is to show you the statistics based on today's rates, actually. And this is the in terms of Canada-wide, what we're seeing. So the number of total cases, and you could also access this on the government webpage as well. So the total cases that we're seeing within Canada is 48,500. People who are hospitalized are 2,704 people so far. ICU is 519. Number of deaths Canada-wide is about 2,707 people. And if you're looking at Ontario, it's about 14,856 people who've identified as cases of COVID-19. Individuals in hospitals are 945. People who are in ICU, 241. And the number of deaths Ontario-wide is 892. So you could also look for your citywide municipalities as well. You can tune into your local public health unit website, and you can track the total number of cases per day, along with the hospitalized and deceased as well. So in terms of mortality, we have about 6% if we're looking at Canada-wide. And this is much, in comparison to a lot of other countries, this is much lower, and as Subani has also showed in the previous slides as well. And also, as I mentioned, as Subani has mentioned, the number of deaths in Quebec and Ontario are probably the highest in terms of different provinces around Canada, and partially because of the population as well. And unfortunately, we are seeing more of the deaths with the most vulnerable populations of our country, and that's about 75 to 80% of the deaths, which is happening in long-term care. So here's another chart, which is also derived from the government ministry webpage. You could also access this and in terms of up-to-date information as well. As you can see, it's dated on April 24th. So this is from January 15th to April 24th. You could probably find updated information for today's statistics as well. And the number of cases are a little bit lower than what you saw on the previous slide, because this is a little bit older in terms of the statistics. So once again, you can see in terms of the age range, the amount of people who are impacted, you can see far more individuals that are in the senior age group being impacted by the virus.
So all these measures that we're taking, all this social distancing and hand washing and stopping the schools and not going to work, is it actually helping? Is it actually flattening the curve? This is the term that has been used in the media a lot. So if we actually look at, are we flattening the curve? I think we're not doing terribly. We can see that the amount of new cases are starting to decline in the last, few days. But more importantly, I think then the number of deaths per day are reducing. I think the number of deaths are more meaningful than the number of new cases because in Ontario, we've had some limitations in terms of testing. Therefore, those limitations are kind of going away now. So we're testing more and more people, and that will also result in more and more cases that we're picking up, even though there may be milder symptoms. But I think the fact that the number of deaths are going down is actually very encouraging. If you can, and this is another graph just to show that, a lot of the people that are diagnosed with the COVID-19 disease are resolving. That's the green. All the green are people that are resolved from this disease. And then the yellow graph is like the amount of people that are sick but not in hospital. So that's the majority of the people actually. And then there is, people who are hospitalized and people who have passed away. If you look at the trend of the graph, you can actually see that it's not really going up steep like that anymore, but it's actually flattening out more. So I think this is actually quite reassuring. So நாங்கள் செய்யும் முயற்சிகள் எல்லாம் இந்த வருத்தம் பரவுவதை குறைக்குதான்னு நாங்கள் பார்க்க போகல. நான் நினைக்கிறேன் கடைசி மேபி ஒரு 4-5 நாளா புது கேசஸ், அதாவது ஒரு நாள்ல எவ்வளவு புது கேஸ் வருதுன்றதை பார்க்கறது அது குறைஞ்சு கொண்டு போகுது ஒவ்வொரு நாளும். அதே மாதிரி எவ்வளவு பேர் இந்த வருத்தத்தால் இறக்கினம்ன்றதும் கடைசி 4-5 நாளா குறைஞ்சு கொண்டு போகுது. இதனால நான் நினைக்கிறேன் நாங்கள் டெஃபினெட்லி இந்த வருத்தம் பரவுறதை குறைச்சு கொண்டுதான் வரோம். இந்த கிராஃப்லயும் நீங்க பாத்தீங்கன்னா இந்த the amount of people that are sick, the yellow graph, அது வந்து இப்படி ஸ்டீப்பா போகாம, அதாவது செங்குத்தாக போகாம மோர் ஃபிளாட்டா தட்டையா போறபடியா அது அந்த நம்பர்ஸ் வந்து குறைஞ்சு கொண்டு போகுது. So when can we loosen all these rules about social distancing and not gathering with family members and friends and things like that? When can we do this? Can we do that now? Because we're flattening the curve. Actually, I don't think we can do it yet. There are lots of, plans being made by the provincial government, by the local government, by the federal government, about reopening, because we really want to kickstart the economy again. But I do really think we need to be very careful, and we have to do it very gradually, because if we do open up, I do think we will see second and third waves. We will see these probably anyways, but we can hope that if we do it gradually and carefully, that these waves are not that very high. I think until we have an increased level of testing or treatment or vaccine available for this disease, we have to somehow still continue to prevent the spread of this disease. இப்போ நாங்கள் எங்களோட வாழ்க்கை நிலையை நோமலுக்கு வரலாம் என்று பார்த்தால், நான் நினைக்கிறேன் இன்னும் அந்த நிலைக்கு நாங்கள் வரையில்லை. even though அந்த ஒவ்வொரு நாளும் அந்த நியூ கேசஸ் குறைஞ்சு கொண்டு போகுது, ஆனால் ஸ்டில் நாங்கள் ஒரு கேர்ஃபுல்லாக தான் இருக்கணும். திடீரென்று கடைகள் எல்லாம் திறந்து ஸ்கூல் எல்லாம் திறந்தால் கட்டாயம் இந்த வருத்தம் திடீரென்று கூடும். அதனால நாங்கள் கவனமாக கொஞ்சம் கொஞ்சமாகத்தான் ஓப்பன் பண்ணணும், அதாவது இந்த ரூல்ஸை லூசன் பண்ணணும். அப்படி திடீரென்று நாங்கள் எல்லாத்தையும் ஓப்பன் பண்ணினா கட்டாயம் இரண்டாவது தரம் ஒரு பெரிய நிறைய ஆட்களுக்கு திடீரென்று வரலாம், இந்த மூன்றாவது தரம் திடீரென்று வரலாம். அதனால நாங்கள் கவனமாகத்தான் இந்த ரூல்ஸை குறைக்கணும். அதாவது கூட டெஸ்டிங் செய்யக்கூடிய நிலையில் இருக்கணும். மற்றது தடுப்பூசி இருந்தால் அல்லது இந்த வருத்தத்துக்கு மருந்து என்ன ஸ்பெசிஃபிக்கான மருந்து கண்டுபிடிக்கும் வரையும் நாங்கள் இந்த வருத்தம் பரவுறத கொஞ்சம் கவனமாக குறைக்கத்தான் வேணும். குறைக்கிறது இந்த சோஷியல் டிஸ்டன்சிங், ஹேண்ட் வாஷிங், அது நாங்கள் செய்து கொண்டே தான் இருக்கணும் ஒரு இந்த வருத்தத்துக்கு ஒரு வழி காணும் வரையும். அடுத்ததாக next Tharani is going to talk about her experience at Toronto Public Health.
So at Public Health, every public health unit, we're the ones that get the positive reported cases. So any positive cases will be reported to the local public health unit, depending on where you live, not necessarily where you get tested. So if you live in Durham and you got tested in Toronto, the results will go back to your local public health unit. So in terms of getting access to these results, generally, what we would recommend is to sign into the portal. So you could access your lab results online at COVID-19 results at ehealthontario.ca to access your own lab results. So you do have to have your health card with the version code. If you do not have a health card, or you have a health card that is expired, or a health card that is a the red and white card, you could call your local public health unit to help access those results, your family physician, or the assessment center where you got tested. So once usually the positive cases get reported to Toronto Public Health or any public health unit, they will take those positive cases and contact those individuals to identify the contact tracing. So which that means that we identify those individuals and connect with anyone that they might have come into close contact with. So that means if anyone is listed within the household, they would be identified as close contacts, or if they've gone to a grocery store or a pharmacy, or they were an essential worker and they're working. So all of those individuals or places will be identified in the contact tracing, and those respective individuals will be getting a call from their public health unit. So in terms of testing, we get a lot of inquiries about where to go get tested. There are several assessment centers across the GTA. Most of the hospitals have actually opened up an assessment site. Usually it's outside of the hospital, or they have a separate unit for the assessment centers as well. You could search for them online, or you can call your local public health unit once again to inquire about the closest assessment center to your home. They are mostly open 7 days a week, but they do have very different hours like in terms of when they're open. So in terms of testing, who are they testing right now? In the past, in the last couple of months, it was very, very strict in terms of who they were testing. As Subani mentioned earlier as well, they have loosened the in terms of who they are testing now. They've expanded the criteria a bit. So here's a list over here that you can see. So in terms of people who are being tested right now are seniors, anyone with an underlying medical condition or a compromised immune system, people living or working in congregate settings. So that could be like any type of institutions or long-term cares, prison settings, group homes, anything of those kinds of settings where there's a lot of individuals, so even shelters. Anyone that's working or living in those settings, anyone that is showing any form of upper respiratory tract infections will be tested or sent to be tested, and they're sent as priority individuals. Healthcare workers, first responders, and essential workers are also put up on this priority list as well, along with individuals that might be living in either remote or isolated areas, and also rural or indigenous communities as well.
I can speak about what is happening at the hospitals and medical clinics in sort of your community. So at the hospital where I work right now, and I assume, you know, in all the other hospitals as well, there is something called pandemic planning in place. So what we've done is that to make room for coronavirus patients to have the capacity to take care of the coronavirus patients. All non-essential services have been ramped down and discontinued actually at this time. And we've created like separate pathways for in the emergency department, in the regular wards, in the ICU setting. All places are separated in COVID positive and COVID negative patients. So everybody, this is all being done to protect you if you need to come to the hospital, to protect you from getting the virus at the hospital. So I think it's actually quite safe to go to the hospital now at this time. But you can also see that even within the GTA, the numbers of cases are different by geographical location. For instance, in sort of the Toronto core area, there are more cases compared to like the more suburban area of like Halton. We don't really have that many cases. And I think it's, again, to do with the population density and then just the amount of people that live there. Unfortunately, we have seen that the long-term care facilities are facing the biggest outbreaks and the biggest sort of difficulties with this. And to help with this, we are actually, from the hospital perspective, we are providing staff and other sort of, resources to long-term care facilities to help them with their outbreaks. And even local public health, the provincial government and the federal government, they're all trying to support the long-term care facilities because unfortunately they do have the biggest number of cases and the biggest number of deaths. From a family medicine perspective, I have been seeing most patients virtually. So either I make a phone call with them or I video conference with them for their visits. I'm only selecting a very few people that really need to come into my office. And when I see them, I wear the appropriate, personal protective equipment. We make sure that they wash their hands. And if they do have symptoms of cough or anything, we offer them a mask to wear so that we can protect ourselves and other people who are coming to our clinics and my staff as well. So family doctors are still working and they're still seeing their patients just in a slightly different way. And I also want to, talk about this point that, we have seen a tremendous decrease in people coming to the family physician's office, going to walk-in clinics, going to emergency departments, which is not a bad thing. But I do really think that, I don't think you should be afraid of the coronavirus and not seek help for your medical conditions. All emergency departments are open for any emergency, not just COVID-19 disease, for any health concerns. If you feel that you need to go to the hospital or you need to see a doctor, please reach out. Because like I said, most family doctors are still doing their job, they're still functioning. And they can definitely help you. Or if you feel that you have, your symptoms are quite severe and you need to go to the hospital, I encourage you to go to the hospital and have it checked out. Specifically in like the the COVID-19 patients, if you have difficulty breathing, if you have shortness of breath, chest pain, if you have fever that is not going away with taking Tylenol, I would recommend you go to the hospital and have it checked out. I want to say this in Tamil as well. So இப்பொழுது கூடுதலான மருத்துவமனைகளில் அதாவது தொற்று நோய் திட்டம் என்று கொண்டு வந்திருக்கிறார்கள். இது என்னென்னால் கொரோனா வைரஸ் பேஷண்ட்ஸை பார்க்கறதுக்காக அங்கே அத்தியாவசியம் இல்லாத சிகிச்சை எல்லாம் நிப்பாட்டப்பட்டிருக்கு. அந்த இடங்கள் அந்த ஏரியா எல்லாம் கொரோனா வைரஸ் பேஷண்ட்ஸ் வந்தால் அவையை பார்க்கறதுக்காக மாற்றி இருக்கு. அதே மாதிரி எமர்ஜென்சி டிபார்ட்மெண்ட்ஸ்லேயும் ஐசியூ எல்லா இடத்துலையும் கொரோனா வைரஸ் பேஷண்ட்ஸை புரிம்பா பார்க்கறதுக்கு இடம் செய்து வச்சிருக்கணும். அண்ட் கொரோனா வைரஸ் இல்லாத ஆக்களை புரிம்பா பார்க்கறதுக்கு இடம் எல்லாம் கிரியேட் பண்ணி வச்சிருக்கு. ஏனென்றால் இங்க வார எல்லாருக்கும் கொரோனா வைரஸ் தொத்தாம இருக்கிறதுக்காக அப்படி பொறிச்சு வச்சிருக்கணும். அதனால உங்களுக்கு என்ன வருத்தம் இருந்தா நீங்கள் மருத்துவமனைக்கு போக வேண்டும் என்றால் கட்டாயம் பயப்படாம நீங்க போங்க. ஏனென்றால் லைக் கொரோனா வைரஸுக்கு பயந்து வேற வருத்தங்களை நீங்கள் கவனிக்காம இருக்க வேண்டாம். மற்றது அந்த முதியோர் இல்லங்கள், ரைட், அதாவது நீண்ட கால long-term care. Let me see. அதாவது நீண்டகால பராமரிப்பு இல்லங்கள், ரைட், லாங் டேர்ம் கேர் ஃபெசிலிட்டிஸ். அங்கேதான் கூடுதலான ஆட்களுக்கு கொரோனா வைரஸ் வந்திருக்கு. அது ஏனென்றால் அவை கூடுதல் அங்கே இருக்கிற ஆக்கள் எல்லாரும் வயது போனாக்கள், அவைக்கு வேற வருத்தங்கள் இருக்கு. அதனால அந்த இடங்கள்ல தான் அந்த வருத்தம் கடகடண்டு தொத்துது. அதனால அந்த லாங் டேர்ம் கேர் ஃபெசிலிட்டிஸுக்கு வந்து லோக்கல் ஹாஸ்பிட்டல்ஸ், லோக்கல் இது ப்ரொவின்ஷியல் ஹெல்த், பப்ளிக் ஹெல்த் எல்லாரும் அவைக்கு உதவி செய்யணும் அந்த 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 வருத்தம் தொத்துறதை குறைக்கிறதுக்காண்டி. மற்றது நீங்கள் உங்களோட ஃபேமிலி டாக்டர் அவைய ஆஃபீஸை நீங்கள் யோசிச்சு பார்த்தீங்க என்றால் கூடுதலான ஃபேமிலி டாக்டர்ஸ் அவை ஸ்டில் வேலை செய்யணும். எவ்ரிடே அவை வேலை செய்யணும். கூடுதலாக அவைய பேஷண்ட்ஸை வந்து விர்ச்சுவலாக தான் பார்க்கணும். அதாவது ஒன்றில் வீடியோ கான்ஃபரன்சிங் மூலம் அல்லது டெலிஃபோனால தான் அவையோட கூடுதலாக கதைக்கணும். ஓன்லி குறைஞ்ச ஒரு நாளைக்கு ஒரு 2-3 ஆக்களை தான் நேரில் பார்க்கணும். அதுவும் அந்த நேரில் பார்க்குற ஆக்களுக்கு அவைய கவனமாகத்தான் பார்க்கணும். தாங்கள் அந்த மாஸ்க் கவுன் எல்லாம் போட்டுக்கொண்டு தான் அவைய பார்க்கணும். ஏனென்றால் அவைக்கு அந்த கொரோனா வைரஸ் தற்செயலாக அந்த அவைய ஆஃபீஸுக்கு வாரதாலே அவைக்கு தொத்தக்கூடாதுன்றதுக்காண்டி கவனமாகத்தான் எல்லாரும் பார்க்கணும். மற்றது நீங்கள் அவசர சிகிச்சை நிலையங்கள், அதாவது எமர்ஜென்சி டிபார்ட்மெண்ட்ஸை பார்த்தீங்களென்றால் அது எல்லாம் திறந்துதான் இருக்கு. கொரோனா வைரஸ் பேஷண்ட்ஸுக்கு மட்டும் இல்லை, எல்லா பேஷண்ட்ஸுக்கும் எல்லா எமர்ஜென்சிக்கும் திறந்துதான் இருக்கு. ஸோ நீங்கள் பயப்பட தேவையில்லை. நீங்கள் ஹாஸ்பிட்டலுக்கு போகணும் என்ற ஒரு நிலை இருந்தால் நீங்கள் பயப்படாம போகலாம். அவே அங்கே உள்ள நர்சஸ் மேல் உங்களை எவ்வளவு இந்த வருத்தம் தொத்தாம எவ்வளவு பார்க்கலுமோ அவ்வளவு ட்ரை பண்ணி அந்த தொத்துறதை தடுப்பினோம். அண்ட் ஸ்பெஷலி நீங்கள் இந்த கொரோனா வைரஸால மூச்செடுக்க இல்லாத நிலை இருந்தால் அல்லது காய்ச்சல், நீங்க டைலனால் எடுத்தும் காய்ச்சல் குறையாமல் இருந்தால், அல்லது உங்களுக்கு நெஞ்சு நோ அப்படி என பாரதூரமான அறிகுறிகள் இருந்தால் கட்டாயம் நீங்கள் பயப்படாம எமர்ஜென்சி ரூமுக்கு கட்டாயம் போங்க. ஏனால் அங்கே they can help you. அண்ட் மற்றது வேற உங்களோட வருத்தங்களை பற்றி உங்களோட ஃபேமிலி டாக்டரோட ஸ்டில் உங்களோட மருந்து எடுங்கோ. அண்ட் ஸ்டில் அவைய ஆஃபீஸுக்கு நீங்கள் டெலிஃபோன் பண்ணி பாருங்கோ. அவை கூடுதலான எல்லாமே உங்களுக்கு அவை செய்வினம். நீங்கள் உங்களை நேரில் பார்க்காட்டிலும் உங்களோட மெடிக்கேஷன் எல்லாம் உங்களோட ஃபார்மசிக்கு அனுப்பிவினம். அப்படியான இதெல்லாம் தொடர்ந்து செய்து கொண்டு தான் எல்லாரும் இருக்கிறோம். ஸோ நீங்கள் கொரோனா வைரஸுக்கு பயந்து உங்களோட வேறு வருத்தங்களை நீங்கள் கேவனாம விடாதீங்க. So this is the end of the presentation. We can take questions both in English and in Tamil.
I have a couple of questions here.
Yeah.
When they start reopening places, how much precaution do you think we should be taking?
So I personally think we should still be careful. So I think even when places are opening, I still feel that the social distancing is an important part of decreasing the spread. And I also think, you know, if you're unable to do the social distancing, I do think there may be some value in wearing a mask, for instance, in those cases.
And as Subani mentioned, I think a lot of workplaces, if they are able to still work from home and still function as an organization, they're going to continue to do that. For work in terms of people who have to come into work, I think there's going to be a lot of precaution in terms of providing that 2 meter apart between individuals and a lot of more accommodation in terms of spreading people out in workplaces. And also, once again, the physical distancing is going to still continue for a while, even though things might still open up.
Thank you. Still have more questions here. Thank you so much, everyone, for sending your questions to us. When do you think is the right time to start reopening the economy? Sorry, let me read that again. When do you think is the right time to start reopening the economy?
So I personally think, you know, if at a time where we have, you know, a lot of testing capabilities available, if the number of the cases that are happening every day, if they are manageable, to a point that we can contact trace every single person that has come in contact with that person that has tested positive, if we have vaccination, for instance, for the disease, or if we have proper treatment that can, you know, shorten the time that you're sick, and even, you know, prevent you from getting sick, or treat fully, those are sort of the times when you can fully open like before. But I do understand that there is a lot of, you know, a lot of small businesses and a lot of, you know, industries are suffering because of this, you know, shutdown. I do understand that, and even schools and, you know, and activities for children and, you know, and workplaces, I do understand that there is unlikely that we can wait that long. We can shut, you know, everything down for that long. So that's why I do think it's when we do open, it has to happen gradually. We have to continue, you know, we have to be very vigilant and continue to monitor the number of cases and the spread, and try to identify where they are and how we can contain them, and then gradually open up. And when that can happen, I don't really know.
Mm-hmm.
I don't know. What do you think, Dharani?
I agree with you. I don't have a timeline for that either. And I think it's more so the baby steps and gradually opening it, especially as we start to see the lower of death rates and in terms of the curve kind of flattening. I think it's more so not just opening everything wide, and it's more so gradually opening certain services that are like, right now, essential services are still open and running, but in terms of like the next in line for in terms of services and stuff like that, I don't think we're going to start to see a lot of the services open and people are going to start gathering in big spaces. As you know, a lot of summer festivals have still been canceled. So that's going to remain canceled. So those are some of those indicators showing you that there's still going to be some cancellations going forward in terms of mass gatherings.
Thank you. For testing, do condos and apartments count as congregate living?
No, they do not. Condos or residential buildings are not considered congregate building or settings, just because they are able to self-isolate within their own unit. We do receive a lot of calls from landlords or other individuals in their own unit saying that they want to know people who've been tested positive in a condo unit. Public health can't identify or provide information on who's tested positive or not. So congregate settings are things such as group homes where people might have to use one washroom, or there are only 3 washrooms in the entire home, where multiple people have to go in and out. Settings like senior homes, those are congregate settings, as well as shelters where there's not a lot of access to isolation in terms of self-isolating within a room with washroom access.
Mm-hmm. You've mentioned masks a few times. What about gloves?
I mean, I think you can wear gloves. I don't think there's any harm in wearing gloves. But the important part of gloves is, gloves are really meant to be used as, one instance sort of use. So wearing the same glove all day long is not going to help, because you're probably going to touch yourself, your face, or anything like that with the glove, but that is potentially dirty or has, coronavirus on it, right? So if you're thinking about wearing gloves to, for instance, to go to the grocery store, I think that makes sense. You can wear your gloves to grocery store. When you pick up the groceries, a lot of people are sanitizing their groceries when it comes home, or like leaving it out for a couple of days before bringing it into the house or into their pantries. If you want to wear gloves for those instances, I think that's fine. You can use that, but I don't think it's a good idea to wear one pair of gloves all day long. I think that just works. That doesn't really do anything to protect you, actually.
Yeah, and it causes more harm wearing one glove for a whole day, or your entire, say, like your shift period at work, because you're doing more of the cross-contamination when you're doing that. So gloves should be used only if you're using it for one purpose and a one-time use. So for example, if I'm leaving my unit at a residential building to go underground to go to my car, I put on gloves, touch all the surfaces I need to. When I get in the car, I take those gloves off and put it in a little garbage bin that I might have in the car. So things like that makes it more sense because you're using it for one purpose. But we still highly recommend over glove use is the hand washing and sanitizing as much as you can.
I have a few more questions, but I wanted to open it up to people that are listening. If you have any questions at this time. Okay, I'm going to continue. Do they separate hospital staff in COVID plus and COVID negative areas, as well as the patients?
So I can speak about the hospital that I work at. We definitely have dedicated staff for COVID wards and COVID ICU. That is staffed by different people and people who are taking care of other people. They don't go into those areas. But unfortunately, this is not really possible in all hospitals. So I also work in a small rural hospital. And I saw a COVID patient there, and really, in the emergency department, I'm the only doctor and there's only one nurse with me. So really, there's no way that we can, have a dedicated physician for COVID patients and other patients. So it really depends on the location. I think the bigger hospitals in the bigger cities, they are definitely trying to separate, staff, that are taking care of COVID patients, that they don't take care of other patients.
Okay, thanks, Subani. We have a question on Instagram. Is there a plan if there is a second wave? Do you think we will be taking the same measures?
I think these measures, have helped to flatten the curve. I think it would be similar measures. I would imagine. Yeah. Hopefully, at that time, at the time of second wave, we would have more testing available. We can do better contact tracing because we do have some experience with that now.
Yeah, I agree. Like, I think if there were to be a second wave, it would be very similar measures, depending on how hard it's going to hit us as well. If we're starting to maintain these measures that are already in place and just loosening it a little bit, I think the second wave won't be as impactful as it was this time around.
And we have seen second waves in other countries,
Yeah.
right? So Singapore and South Korea and stuff, they have seen second waves, and they are also trying to go back or try to deal it with the testing and trying to isolate those people separately. Yeah, similar measures.
Mm-hmm. Thanks. Another question. My grocery store had an employee test positive. They cleared professionally. Would you go back? Oh, sorry. They cleaned professionally. Would you go back?
Yeah.
I would go back. Yeah.
Yeah.
I mean, I no matter, if the grocery store employer has it or not, I'm taking my own precautions. For instance, when I go to the grocery store, I sometimes wear gloves, not always. Sometimes I don't wear gloves. I touch everything, but I make sure when I come home, I, wipe down all my all my stuff, and I wash my hands, right? So I'm just assuming that it's everywhere. And I'm trying to protect myself. So it doesn't matter if the person at the grocery store has it or not.
Yeah, and they do have protocol from the Ministry of Health in terms of if any workplace settings do have anyone that's tested positive, whether it be a staff member or a customer that visited the grocery store, they do have processes in terms of how they should be cleaning. So the deep cleaning, which is why most grocery stores are usually shut down for a couple of days in order to do the deep cleaning as well. So it is safe to generally go back to that same grocery store, especially if that's the one that's closest to you and it's most convenient for you. But as Subani mentioned, taking your own extra precautions when you're doing so as well.
And the other thing is that, just because we know that this grocery, had a person that had a positive doesn't mean that other people don't have it, right? There are still some cases known that are pre-symptomatic or asymptomatic. So these are people that have no symptoms, or they haven't developed any symptoms yet, but they are still able to spread the disease. So, I think, if you're going to be within 6 feet of a person or within 2 meters, distance from a person, I think you have to take precautions.
Thank you. A couple of more questions. How many cases are we potentially at with our limited testing?
So how many cases are we missing? Is that the question?
Yeah, I think so. I'm not sure. It just says how many cases are we potentially at with our limited testing?
So in terms of testing, especially in the first couple of months, because of limited testing, there were a lot of people who were asked to just self-isolate, and priority was given to the most vulnerable populations, right? So most people were self-isolating, most likely probable cases of COVID-19. And they usually get resolved within the 14-day gap and are symptom-free after, right? So there have been a lot of people who've been self-isolating who've not been tested, who might be probable cases. So there are a lot of people who probably are not caught within the amount of cases that we see citywide or province-wide. So luckily we do see that there is more testing capability now, and they've also heightened in terms of who is going to be tested. The priority has shifted a little bit, or widened a bit. So we'll see more cases, but then again, we still have to consider most people in the mid-age range without underlying health conditions are still asked to just self-isolate unless they have someone that has underlying health conditions in the home. So in terms of cases or testings, it's really hard to depict how many people are tested positive or not, just because testing is not as accurate in terms of depicting how many people in the city of Toronto or in Ontario might have the virus.
Mm-hmm.
Yeah, it's interesting. In Iceland, for instance, they did like a population-wide test, and they found that, you know, I think it was like 0.7% to 1% of the population was positive. But then of those people that were tested positive, only 50% had symptoms. So you can see that, you know, if we're not testing anybody, you know, that has no symptoms, we're off the bat. If the numbers are similar to Iceland, we're off the bat missing 50% of the people.
Right.
Right. And then, you know, and then we also have restrictions in terms of who we test and who we don't test and stuff. So the numbers are like much, much higher than we have as positive COVID-19 cases, much higher. And you can also see that on the mortality rate as well, because if, places that have more wide range of testing available, their mortality rates are actually much lower, like, you know, in the, you know, like around the 1%, maybe 1.5%. In Ontario, like we said in our, you know, earlier slide, it's about 6%. And that's not because we are doing worse. It's because we are not testing enough. But, you know, does that mean that we have to test everybody? I don't think so. I don't think it really makes a difference if we know who is, you know, positive or not. I think the social sort of, you know, measures we have to take anyways. It doesn't really matter if that, you know, the number doesn't really, you know, matter. We still have to take the precautions, because we're not at a point where 60% of the population is positive, right? If we get to that point, then we can, you know, say, you know, there's so many people, you know, already have it, you know, there's no point in doing these, you know, social distancing and all that sort of stuff. But we're not there yet. So I would say, you know, the incidence is still like, the prevalence in Canada is probably, you know, still reasonable, but we're definitely not testing everybody, picking up everybody.
Yeah, and just to add on to what Subani said, we're asking anyone to self-isolate with any flu-like symptoms or cold-like symptoms. So whether it is a common cold or just a common flu, or whether it be COVID-19, they're asked to self-isolate to reduce the exposure, right? So now, in terms of if they get tested or not, or they're just self-isolating and waiting out that whole incubation period, that helps to still reduce the amount of spread outside in the community. So it ultimately, yes, in terms of is that person going to get any different of an answer if they're tested positive? It's just the fact that they are tested positive, but anyone with a respiratory infection at this point is asked to self-isolate. It's the same measures that are being put in place in terms of people who are tested positive or people who aren't tested positive but are still showing signs and symptoms.
Mm-hmm. Couple more questions. What are some of the hardships witnessed by you on the front lines? It might be a heavier question to answer.
So I think I really feel that the most difficult thing that I am dealing with my elderly patients who are in long-term care facilities, or who have, you know, like, or who have the disease, or who are living in a long-term care facility, is that they can't have any visitors,
Mm-hmm.
right? It's really heartbreaking to see that somebody, you know, is living in these long-term care facilities. They're used to having their loved ones, you know, a couple of times a week coming to see them. That's really their only, you know, joy that they, you know, see, you know. And then now, because of this, you know, outbreak, none of the long-term care facilities are allowing any visitors. So no matter what, what is going on, you're not allowed to see your loved one. So, and then, most of these people, they're not tech savvy enough to use an iPhone or an iPad or whatever to, to even see their loved ones that way. So it's really, I think that is the hardest thing that I witness, is that people who are dying, who are coming to hospitals, they are not allowed to see their loved ones. I think that's really heartbreaking.
Yeah, that's similar to what I'm seeing as well. And some of the other things I'm hearing as well are people who are being evicted by landlords because they've tested positive. So that's upsetting. And there is help for people who are experiencing that. And you can call the ministry in terms of people who deal with landlords and tenant board. For help. You can also access hotels. A lot of hotels have opened doors to allow people to self-isolate if they've tested positive, especially if they're not able to stay at home because they have a loved one that has a compromised immune system. So we're hearing a lot of the eviction from tenants, from landlords, which has been a little bit heartbreaking because it's tough times for everyone. So that's some of the things that I'm also dealing with on a regular basis.
Yeah, and the other thing is, frontline workers who are afraid to be with their families, right? You probably have heard of cases where, doctors who work in emergency departments, doctors who work in ICUs, nurses who work in emergency departments, that they are living in little RVs in their front yard because they are afraid to go home and hug their kids because they are afraid that they're going to pass it on to their kids unknowingly. So, and that's heartbreaking too, because I don't think we can do this for very long. I don't think, anybody can stay separated from their families and their children and their loved ones, for very long. So I think that's also sad. And that's, even though it's not, directly, well, I guess it is directly related to the coronavirus outbreak. Yeah.
Thanks, Subani and Dharni. We're also being told that folks can search ontario.ca/rent for landlord-tenant issues if anyone's facing eviction or any sort of tenant issues. With regards to, sorry, it looks like we're having a bit of a technical issue on Instagram. So I just have one more question that someone's asking, and I think this question is coming from a place of John Tory recently had suggested that we're going to reopen dog parks first. And on a more lighter note than the previous question, can I pet my neighbor's dog?
That's a good question. I mean, I don't know. I don't know, because the thing is, we're talking about surfaces, right? Like touch surfaces. So if your neighbors, obviously they touch and pet their dog, and if they do have the coronavirus, they can easily, transfer it to the dog, even though the dog might not get sick. When you pet the dog, you can actually pick it up. So I would say no.
Yeah.
Yeah.
That makes sense. Okay, well, that concludes the questions, and it looks like our Instagram Live is back on, so maybe we can start concluding.
Perfect.
Anyone have any last minute questions? I think we're back on Instagram now. Okay. Well,
If
thank
there are no other questions, I want to thank Tharani
Thank
for
you.
doing this with me, and I want to thank everybody who joined us to make this possible.
Thank you.
Thank you to you both.
Thank God. Is there
John,
anyone in this? Oh,
oh, we can see you finally.
You can see me.
Good job, guys.
I hope John took us off the feed.
I believe we're still on Instagram.
Oh, perfect.
Oh, okay, now we're off.